Hi, Caitlin. Thank you very much for your flashcard presentation on appendicitis. I will be doing my case presentation on this disease. This is something that we see a lot on my pediatric med-surg floor. So TJ is a 10-year-old male who presents to the emergency department with his mom today with abdominal pain. He has no past medical history, but is allergic to peanuts. His mom states that he started complaining of pain yesterday, right around his belly button. Today, he has been crying in pain all day, vomited 3 times this morning, and he had a fever of 103 this morning. She states he really has not been able to keep anything down, even though she has really just been trying to get him to drink Gatorade and Pedialyte. On assessment, TJ has a fever of 102.8, he's tachycardic to 130, is breathing at a rate of 32, his O2 sat is 98%, and his blood pressure is 100/62. He's alert and oriented, though tearful. His heart and lung sounds are normal, however, other than the tachycardia and tachypnea. He is warm, well perfused, with good pulses. On the Wong-Baker Faces scale, he says his pain is a 6 out of 10 and points to his lower right abdomen. There's tenderness and guarding while palpating the area. When you hold pressure on his abdomen in this area and then release the pressure, he complains of pain. TJ then complains of nausea and has an episode of emesis. His mom states that she's really worried about him, stating he never gets sick and it is so awful to see him in so much pain and discomfort. I would suspect this patient has appendicitis. The signs and symptoms that this patient's experiencing that indicate it is likely appendicitis include fever, abdominal pain, starting as periumbilical pain and progressing to the lower right quadrant, rebound tenderness, nausea, anorexia, and vomiting. There are not many risk factors associated with appendicitis. However, males are more likely to have appendicitis than females. It's also more common in young children, but can occur anywhere from ages 5 to 45 years old. An abdominal ultrasound is ordered to check for appendicitis. You also order labs, including a CBC, CRP, and chemistry panel. The patient's white blood cell count is 16 and his CRP is 208, which you suspect because of this inflammatory infectious process. We prescribe pain medications for this patient, including morphine and Tylenol. We start him on IV antibiotics and IV fluids to maintain adequate hydration. You make TJ NPO, which means nothing to eat or drink, in preparation for the patient going to the OR for an appendectomy. All right, and below are my resources here. Thank you for listening.